And today it's really my honor to give a talk on the health workforce management in Taiwan. We do have some achievement, but we have a lot of challenges. So I would like to share with you. And I'll also go through that's our international collaboration to cultivate young talents in global health. And as we all know that according to this two international health statistic, health and care indexes, and as you can see that based on this recent report, Taiwan is often ranked as one of the best healthcare systems in the world. That's according to the Numbeo, as well as the CEO magazine. And for Numbeo Health Care Index, we have around 7 years and consecutive years for #1. And as you can see here, this is a Numbeo Healthcare Index, and Taiwan and Korea were ranked as #1 and #2, followed by Netherlands, Japan, Austria, Denmark, and so forth. And with regard to this CEO magazine, as you can see here also, that Taiwan was the #1, South Korea the second, followed by Australia, Canada, Sweden, Ireland, and so forth. So this kind of high ranking basically come from several important factors. The first one is the universal coverage, because our national health insurance system, we just celebrating the 30 years of this NHRI, and it was implemented in 1995 and covered nearly 100% of the population, including the foreign residents with the status. So for migrant workers, they have the privilege to use our national health insurance, and also for its efficiency and accessibility. And this system is praised for its efficiency, comprehensive coverage, good accessibility, and often allowing people to see specialists without waiting times or referrals. And it's also cost effectiveness. The premium and copay are relatively low compared to other countries. And the digital integration is very important for our healthcare system in Taiwan. And I think the last but not the least is the, I had to come back. The last but not least is the competent workforce. The healthcare workforce is well qualified and devoted with continuing education. And I would like to separate this health workforce in Taiwan into 4 different components. The first one, I would say, this is clinical personnel providing direct patient care, including physicians, surgeons, specialists, nurses, midwives, dentists, pharmacists, as well as the behavioral health workers. And the second group is the support and management personnel. They're providing essential services but not involving in direct clinical care, such as the healthcare management and the administrators, laboratory and medical technician, ancillary and direct care worker, and also these ambulance driver and so forth. And the third group is the public health workforce. I used to be part of this public health workforce, focused on non-personal health services, prevention, and also the population level health. And the fourth group, I would like to emphasize it because it's getting more and more important in Taiwan since we started our long-term care 2.0 since 2016. So I think this long-term care workforce is also very important to take care of the social well-being of the people, of the elderly in Taiwan. This including the caregiver, home care supervisors, case managers, as well as welfare services workers, including work for the child care and life care. And according to our statistic, I'm using this 2022 because I'm going to compare this health workforce of Taiwan with other countries, and according to this our world in data. So I choose this data in 2022. And for this Western medical doctor, we have around 53,000, and then it's 2.28 per 1,000 people. And for practitioner Chinese medical doctor, it's around 9,000. It's given to 0.38 per 1,000 people. And for the nurses, we have 185,000 nurses given there's a nurse to people ratio of 7.98 per 1,000, and the dentist is around 16,000, and there's a practitioner pharmacist is around 41,000. So that's the major health workforce in Taiwan. And let's look at that. There's the comparison in Taiwan and other countries, because in our world in data, they don't consider they use this WHO state member to include it, but they did not include Taiwan. So I would like to give you the data here. And in Taiwan, we combine the medical doctor, that's a Western medical doctor, and Chinese medical doctor. In total, we have around 2.7 per 100,000. And as you can see here, it's something like in this scale. And as you can see that Taiwan has similar medical doctors per 1,000 people, and many high-income OECD countries have a physician-dentist in the range of 3 to 5 per 100,000. And of course, everybody knows that in Cuba, in Greece, the physician number per 1,000 is much higher. It's even higher than 5. And these are quite unique countries. And with regard to this medical doctor per 1,000 people versus this GDP per capita, as you can see that the higher the GDP per capita, the higher this the medical doctor per 100,000. And Taiwan is here. It's quite similar to Japan. And if we compare the nurses and midwives per 1,000 in Taiwan with others, and in Taiwan we have 8 per 1,000 nurses and midwives in Taiwan, and its status is much better than medical doctors. And in Taiwan, so as you can see that Taiwan is physician-oriented, and each physician has around 3 nurses. This is nurses to physician ratio. And as you can see here, this is dentistry personnel, include the dentist and his assistants. And this around 7.1%, and the number is at the middle of this international comparison. And there are more dentistry personnel in Europe. And if we compare this pharmacist per 10,000 population, and in Taiwan is 17.7 per 10,000, and it is arranged one of the highest. This is including this so-called pharmacist for Western medicine, as well as for Chinese medicine, herbal medicines. So you can see there's a pharmacist number relatively higher in Taiwan. And with regard to the education and training of the health workforce in Taiwan, this system is quite complete and has 3 mandatory stage. One is the undergraduate education and postgraduate training, as well as the continuing professional education. For undergraduate education, almost all this health personnel have to get this academic degree in order to get this national professional licensing examination. And for medical doctor degree, usually we have 7 years on the program. But now, recent reform is try to shift some program to 6 years of undergraduate curriculum, and then followed by required postgraduate training to integrate medical school learning and clinical practice. And for this other professionals, they all have to get this degree from the university department or colleges. And in addition to academic education, they have to have postgraduate training. We call this PGY and residency. PGY is a postgraduate year training. And PGY training started earlier in around 2003. And after the SARS outbreak, we consider that we have to let all these medical students to have a very good general medicine training. So we started our PGY program. It's a mandatory one and I think it is very important. And the PGY curriculum emphasizes comprehensive training covering core competencies in general medicine, primary care, palliative care, geriatric, and ensuring a holistic approach to patient care. And with regard to other professions such as nurses, pharmacists, and Chinese medicine practitioners, our Joint Commission of Taiwan, that's JCT, in Chinese is Yi Ce Hui. Yi Ce Hui has also this kind of regulation to standardize the transition from student to independent practitioner. And in addition to the PGY training, in Taiwan, we also have the residency and fellowship training, and in order to train our young talents into specialty board, and they can engage in even the subspecialty training. And in addition to that, every health personnel, they have to have continuing professional education, and this we call this CME, and that's some of the requirements of different health professionals have different requirements. In other words, they have to get this kind of credit in order to get the continuation of their license for practice. And for providers, this kind of continuous professional education are provided by university, teaching hospital, professional association, and government-approved training centers. And I think this the strength of health workforce in Taiwan is provided this universal coverage and high quality. And this is very important for Taiwan's national health insurance system. And also, there's a growing number. The overall quantity of medical personnel, including the physicians and nurses, has generally increased over the years. However, we face a very large challenges, and the challenges are especially from this aging population, and this aging population leads to increased health demands, and this increasing the higher prevalence of chronic condition and need for geriatric and specialized care, and demand for long-term and home-based care. And in Taiwan, we try our best to provide home-based care rather than institutional-based care. And higher healthcare utilization is also another challenge from the aging population. And with regard to the challenges to health workforce in Taiwan, we come across this three major challenges. The first one is workforce shortage and retention problems. And we have a nurse shortage and specialist shortage, and our working environment basically is very challenging and very demanding. So I would say this is a poor work environment, and this is issues has been raised by health personnel, including the underpaid salary, profit-oriented hospital management, and prioritizing financial return and heavy workload contributed to burnout and poor staff retention. I think this workforce shortage and retention is the first challenge and the most important one. And the second challenge is uneven geographical distribution. And medical resources heavily concentrated in major metropolitan area, leading to the disparity of care and care qualities and accessibility in this remote area. And this urban concentration and rural or outlying gaps are quite important in Taiwan. So we try our best to provide telemedicine or increase the manpower for this remote area or even this outlying islands. And the third challenge is the impact of aging population. I just mentioned about that, so I would like to skip this one. But as you can see that since this aging population, so our workforce is also aging, and also this burnout and turnover situation remains very significant. And low wage and poor condition is always the complaint of health professionals here. And how to solve these problems? And to solve this kind of impact of the aging population, I think this workforce education is very important. So we try our best to invest in training and also recruitment more young talents, and even those who consider they would like to do this the direct care in the remote area. We try to have a longer retention of this health personnel, and we try our best to implement the team-based care to promote that interdisciplinary and team-based care model to reduce burden on individual caregiver and ensure integrated and holistic care. And the last one is the support of existing staff. Try to have them to work longer and to have a good retention of the personnel. And for this technology and innovation, usage is also very important. We have to leverage this, the technology, adopt this telehealth, remote monitoring, and digital health record to improve efficiency, access, and informed decision making, and also have predictive analytics to help this provide a good health care. And we also implemented this new care model in this preventive and holistic care, as well as the integrated care. I think this is especially important when we are facing this aging population problem, because the elderly, they have multiple diseases and need this kind of integrated cares. And I would like to go through this long-term care workforce also. And currently, we have around 120,000 local long-term care workers, but we have 200,000 migrant care workers. So we have more migrant care workers than the local care workers. And the long-term care workforce will further expand in the long-term care plan and 3.0 starting in coming year. And we still emphasize the importance of the education and training of long-term care workers. And for the direct care workers, they have different training program, and then they have to get the certification, and they also have to get this continuing education. And all this kind of training program was announced by Ministry of Health and Welfare. And these are very important to train this caregiver, technicians, and direct care workers. And with regard to the professionals and managers, usually they get this academic degree from the formal education, and they have also to get this good training in order to be care managers. And for the migrant care worker, we are also concerned their capability. So for those who have been working here for a long time, we have retention program, and we also supplied that supplementary training to this migrant care workers. So this long-term care regulatory bodies in Taiwan, including the Ministry of Health and Welfare, and Ministry of Labor, and also Ministry of Education. These three ministries work together to improve this, the quality, the capability of long-term care workers. And there are some challenges. The challenges is quite the same to the health professionals, including the age population, low birth weight, dominant foreign worker model. This is our Taiwanese unique situation, and retention and recruitment, and also the regional shortage and professionalized is a need to introduce the new certificate in order to improve the long-term care qualities. And we have the Long-term Care 2.0 implemented in 2017. Now we are going to move to Long-term Care 3.0. Maybe Professor who's going to give a presentation later. And I think that for the future outlook of the long-term care workforce, we will focus on this professionalization and smart care, as well as this, to provide the stable financial support. And I will use the last 4 minutes to share with you that our international collaboration, how to work together with other countries to promote this global health workforce training. And in Taiwan, just as mentioned by our Deputy Minister, there's an ICDF is playing a very important role, and also the Ministry of Health and Welfare. So for the medical cooperation program in allied countries, including a lot of healthcare, and the right-hand one is the healthcare workforce training. And we also held a Global Health and Welfare Forum in Taiwan since 2005, and this, we invited experts participation to highlight Taiwan's effective and positive role and share with others. We hope that it will be helpful. And we have this international conference and educational training through this APEC, also this GCTF, Global Cooperation and Training Framework, and this Tiffany. That's a training program for epidemiologists and public health intervention work. And we, through this kind of platform, and we can help this cultivation of this global health personnel. And we have a Taiwan International Healthcare Training Center. This was established by Ministry of Health and Welfare, and by now we have trained 2,100 foreign healthcare professionals from 80 countries, and provides international medical rescue assistance in 26 countries as well. And the healthcare, health and workforce and training through international collaboration, I just mentioned about the FETP and IPAC and the GCTF. I won't go through the details, but I would like to share with you that the FETP in Taiwan basically starting from 1984, because after this very huge scale polio outbreak in Taiwan, US CDC helped us to set up the field epidemiology training program. And this program is very successful. And all the trainees get an hand-on experience of this outbreak investigation, and also there's how to prevent the spread of the infectious diseases. And FETP is a member of the global TEFNET. It's a training program in epidemiology and public health intervention network. It's a very successful one. It's starting from Taiwan. Now it's in Southeast Asia. As a lot of countries have this kind of training program. And under this APEC cooperation, and we, Taiwan, with this initiative in 2003 with the United States and Thailand, we set up the Health Task Force and then the Health Working Group After we have the health working group, Taiwan held a lot of health-related conference and workshop to train different aspects of professionals. I won't go through the details. And this is another platform that's a global cooperation and training framework, GCTF. GCTF, starting from 2015, that's the United States and Taiwan signed a memorandum, and we studied this on a global cooperation and training framework. And over the past 10 years, and we have held a lot of international workshops, and some of them is on this public health. For example, there's for the MERS, for the dengue, and Zika, and chikungunya, and also the enterovirus, tuberculosis, COVID-19, and so forth. So through this kind of the platform, we try to have a multinational collaboration for the cultivation of global health personnel. And for each individual country, we have Taiwan's new southbound policies since 2016. And as you can see here, there's many countries are involved in our new southbound policies. And we have capacity building, epidemic control, market connecting, and also supply chain. And now we have around 13 hospitals have some collaboration with Taiwan covering 10 countries. And then we can help them to do this hospital health cooperation project and train their health personnel. And the number of healthcare personnel trained from the overseas increased significantly. And with that, I would like to conclude my talk here. Thank you very much for your attention.